Are you wondering whether cinnamon could help manage type 2 diabetes? It's a question we hear a lot, so let's look at what the evidence actually says. Before we dive in, this video is general information only. It's not a substitute for personalized medical advice, and you should never start, stop, or change any prescribed diabetes treatment without speaking to your healthcare professional first. So, what's the connection? Type 2 diabetes is a condition where the body struggles to use insulin properly, leading to raised blood glucose levels. Managing it well matters enormously for long-term health, and it's completely understandable that people look for additional support alongside their prescribed treatment. Cinnamon contains compounds called polyphenols and cinnamaldehyde. Laboratory studies suggest these may have some influence on glucose metabolism and insulin sensitivity, and that's where a lot of the interest comes from. However, when researchers have tested cinnamon in clinical trials with real patients, the results have been mixed and inconclusive. We simply don't yet have strong, consistent human evidence to say it works as a treatment for diabetes. It's also important to know that cinnamon is not licensed by the MHRA as a diabetes treatment, and Nice Eyes, the body that sets clinical guidelines in England, does not recommend it for blood sugar control. Cinnamon is regulated as a food or food supplement, not a medicine. And the treatments Nice does recommend focus on lifestyle changes and medications such as metformin, SGLT2 inhibitors, and GLP-1 receptor agonists. There's another distinction worth knowing about. There are two main types of cinnamon: cassia cinnamon, the most commonly sold variety, and Ceylon cinnamon, sometimes called true cinnamon. Cassia cinnamon contains high levels of a compound called coumarin. Regular consumption of cassia cinnamon in supplement amounts can exceed safe daily limits and is an important safety consideration around potential liver toxicity, so it's not something to overlook. If you're living with type 2 diabetes and thinking about taking a cinnamon supplement, the most important step is to speak to your GP or diabetes specialist nurse first. This is especially true if you take insulin or a sulfonylurea. Gliclazide is a common example. Cinnamon supplements may increase the risk of hypoglycemia. That's when blood sugar drops too low. When combined with these medications, your healthcare professional can assess your individual situation and help you weigh up any risks. And remember, don't adjust your prescribed diabetes medicines based on any supplement without getting medical guidance first. If you do experience any unexpected symptoms after taking a cinnamon supplement, you can report this through the MHRA Yellow Card scheme. Your pharmacist can help you with that. So, to recap, research into cinnamon and type 2 diabetes is ongoing, but clinical evidence in humans is currently mixed and inconclusive. Cinnamon is not a licensed or NICE recommended treatment for diabetes. Always speak to your GP or diabetes specialist nurse before considering a supplement, particularly if you're on diabetes medication, and never change your prescribed treatment without professional guidance. If you found this helpful, leave a comment below. We'd love to hear your questions. And for more straightforward health information like this, give us a like and subscribe to the Bulk Pharmacy channel. We'll see you in the next one.